Hey guys, I want to talk to you today about a topic that has become very popular, and that is delayed cord clamping. There definitely are some benefits to this, and it has pretty much become the standard for any baby that's born that is born vigorous, that is comes out crying and looks great because of all the benefits. Something like 80 to 100 cc's of blood is going to transfer from the placenta to the baby within the first minute or two, and it seems to be mostly due to the fact that when the baby takes deep breaths, it basically increases their chest cavity, and that creates pressure transmitted through the umbilical cord in a negative pressure fashion, and that actually pulls blood from the placenta to the baby. The interesting thing is that there's benefits that are specific to whether you're a term infant or a preterm infant. Preterm infants tend to have less risk of bleeding in the brain and problems with their gut after delivery, and less anemia as well. And less anemia is the main thing that most term babies might benefit from. Although there are some early studies that show that there could even be reduced risk of infections and other issues due to the fact that there are what we call stem cells in that cord blood, and they are very potent and may have benefits far down the road that we don't even really fully understand yet. The only risk that there might be is of a little bit higher risk of jaundice in a baby, particularly in a term baby. So you have to be in a hospital where they can monitor the baby's bilirubin levels to be sure that they don't require what we call phototherapy, which is the light therapy, to treat their jaundice. Aside from that, there really doesn't appear to be any risk, and there doesn't really appear to be any increased risk to the mom either. There were some initial concerns that maybe it was going to increase the risk of bleeding because we weren't immediately managing the placenta after delivery, but studies really just haven't borne that out. So it really appears to be all benefit, virtually no risk for an otherwise vigorous infant. It's extremely important in a preterm baby, but even in a term baby, there appears to be tremendous benefit. Now, the other thing you should know is if you're planning on doing cord banking, it probably will reduce the amount of blood that is available to be placed into the little donation bags after the delayed cord clamping has ended. Keep that in mind if you are thinking about doing cord banking. There's probably only a few really specific reasons why there's potential benefit. If you have another child that's affected with leukemia, you're planning on using this cord blood from the new baby in a stem cell transplant type situation. This, of course, is very rare. Otherwise, for an otherwise healthy kid with no family history of anything strange that we're going to bank cord blood for, the benefit clearly is upfront to do the delayed cord clamping. And if it means you can't get a good enough sample for cord banking, that's probably not a big concern. The technique has been described in different ways, but more recent studies show that you simply just place the baby on the maternal abdomen and wait the minute or two, and then clamp the cord and manage the baby like normal. We can do the initial assessment of the baby right there, clean them up, dry them off, put them right on maternal skin. Again, skin to skin has so much benefit as well. We don't want to interrupt that. So that's really about it to tell you about delayed cord clamping. We think there's a lot of benefit to it. I definitely recommend it to all my patients. It really has become the standard that we do now. So talk to your doctor about it if you have questions. If you have other questions you want to put in the comments below, please feel free to do so, and we'll see you next time.